Hello, my name is Thomas Miller and I'm with the Rick Center here today. We're going to talk about IOs and the insertion on pediatric patients. We're going to be utilizing our pediatric HAL here, our simulator friend, and we're going to demonstrate how that's done. Remember that with IOs, anywhere you read essentially in American Heart Association or the AHA regarding NRP and specifically relating to PALS, anytime that they talk about IV, it's always IV or IO, and they are very interchangeable. The IO is grossly underutilized for a number of reasons, but as healthcare providers, to be honest with you, we've got to get past that sense that we have internally that it's a kind of a barbaric thing to drill into someone's bone. It's a very, very easily accessible and rapidly accessible route to instill fluids as well as medications. So just remember that any drug or fluid that can be given IV can also be given IO. And the IO is usually very quick to assess, unlike at times, especially when we talk about a pediatric patient being hemodynamically compromised in shock, that their venous access is extremely difficult. So in those situations, think IO first, and that's okay to do. So we're going to demonstrate the IO here. We utilize here the Easy IO drill, which makes it extremely quick and easy to get the needle into the bone. And then we're going to use, with pediatric HAL here, we're going to use the Easy IO 25 millimeter needle. And so it comes in a kit. We're going to just quickly look at that kit here. I hope this is what your institution utilizes as well, because everything is self-contained. So of course the needle itself, there are three main needles. The blue that you see here is the 25 millimeter. The pink ones or the red ones are the short ones. They're 15 millimeter, really reserved for babies. And then we have the yellow one, which is the longer one. It's a 45 millimeter needle, and we usually access adults' proximal humerus sites with those. So, but for peds patients, the blue one is the one to go to. Also contained in here is what they call the Easy IO catheter. And this little pig tubing here is what we're going to flush with saline and attach it to our needle after we insert it into the bone. Our safety device for our IO needle after we do the insertion, so we don't harm ourselves or other healthcare providers at the bedside. And then every kit also comes with an armband, and it's important, as the information designates here, where you put the insertion site, your name, and the date. So these and time, these IOs are good for 24 hours. We should remove them within 24 hours, and it really gets us past that emergency time where we need access quickly, and we can look then at other access points after we have the patient stabilized. So 24 hours is the cutoff for IOs. So the site that we're going to use on our patients here is we want to use the proximal tibial site. You want to locate their medial tuberosity. It's that little bone just inferior to the patella, okay? You put a finger there, and you want to go about 2 to 3 centimeters inferior to that. So our insertion site will be here. And if you can feel like your own tibia or a patient's tibia, what you want to do is you want to feel that flat part of this tibial bone that's going down here. You want to just drill in the middle of that flat access point of the tibial bone there. So I'm going to wipe it off with some alcohol here. Right here. This is how the needle attaches to the drill. It has a little magnet that holds it on there. It's not super strong, but it's strong enough to hold it on. When you remove the cap from the needle, just hold the needle in place and remove it like so we don't pull the needle back off the drill. We're going to locate our landmark. Remember, it's about 2 to 3 centimeters below the medial tuberosity on the tibia. So we're going to go right below where my finger's at. You want to find that flat part of the bone, 90-degree angle. You go into the skin till you hit the bone, and then you apply pressure to the drill with a moderate amount of pressure pushing down. Remove the drill from the needle. The most common question we get is, how do we know that the IO needle is in the proper place? And the first thing that you'll observe when you remove that drill is that your needle's setting taut into that bone. It's not floppy, it doesn't move around. So long as it's stable and sturdy, that's your first sign that you're in the right position. So next, you want to hold the bottom portion of the IO needle down here with one hand, and the top portion is going to unscrew off. And that's the trocar part. That's the part that actually drills into the bone, leaving the needle that we're going to instill fluids and drugs through. So we're going to set this over to the side. Next, we want to attach a dry syringe to the needle itself and aspirate out. What we're looking for when we do that is a little bit of bone marrow, which is the second way we confirm proper placement. That bone marrow, if it comes up, is going to be a bubbly substance. It's not blood, so it's not free-flowing. And you won't always get it, which is not telling you that you're not in the proper location. You'll get it most of the times, but not every time. So after we remove this, we need to put on what's called the EZ-IO stabilizer. And this is going to attach just like so. It goes down over the needle. We remove the sticky portion of it, and then it sets in place, holding the needle in good position so it doesn't get dislodged. What we worry about with IOs and how IOs get dislodged and knocked out is if something hits them from the side. And so this EZ-IO stabilizer protects that needle, and it gives you a good access then. Next, we attach the EZ-IO catheter, which has been flushed with saline. We put it into position, screws onto the hub here, and then we flush it, and it should flush easy. As we flush it, and as we instill fluids too, we always want to check the posterior side of their leg to make sure it's not getting hard or cold, or obviously increasing in size from swelling. And that flush should just flush easy. Once we get that into position, your flush syringe comes off, and here's your EZ-IO catheter attached. And then it's ready to receive any fluids or any drugs that you may want to give via IO access. Keep in mind that these EZ-IOs are only good for 24 hours. They're a quick access. They're a great access to give any fluid or any drug that you need to. And again, please consider an IO initially over an IV in patients who are hemodynamically compromised. Thank you.